or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It is Health and Wellness Monday, and our topic for today is Unveiling the Impacts of Financial Toxicity on Cancer Care. We are live on Intellectual Radio. We just heard from the Drive F5 with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, I talked about facts about cancer survivorship. You can head on over to YouTube and type in Intellectual Radio and stay connected for any episodes you may have missed. June is National Cancer Survivors Month. So for the rest of the month, we will be talking about pressing issues as it relates to dealing with cancer today. The quote of the day is, "The truth is, in order to get things like universal health care and to revamp the education system, then someone is going to have to give up a piece of their pie so that someone else can have more." And that quote was by Michelle Obama. Here is your trending topic for today. And I'm sure a lot of us have seen the cicadas around Chicago, according to NBC News Chicago. Are you seeing a lot of dead cicadas? You're not alone, but that might means that the emergence in Illinois is coming to an end. It could mean that the cicadas are entering into a new phase of their emergence, the mating phase. Experts have said that cicadas will continue emerging from the ground until late May and early June, but once they emerge, it takes several days before they begin their mating calls. While cicadas have already been spotted in massive amounts in part of the regions and suburbs, they are seeing a shift. According to Dr. Jean Kritsky, Dean of Behavioral and Natural Sciences at the Mount St. Joseph University in Cincinnati, who has been tracking the emergence across the U.S. and particularly in Illinois, noted that at the end of May, that while the number of cicadas are emerging from the ground would decline around the time, that means that the noise won't end, nor will the sightings. Cicadas will still need to live out their full life cycle above ground. The adults will begin singing loudly until mid-June and then dwindle down towards the end of June. He noted that while the emergence has slowed, the singing is still getting louder, which indicates that the mating phase is largely underway. That is your trending topic for today. And I don't know about you, but I'm tired of seeing the cicadas. So I'm ready for them to go away. So that is your trending topic for today. If you are tuned in on any form of social media, like the show, share the show, and invite someone else in on the show that you feel may benefit from this valuable information. Excuse me. We're talking about unveiling the impacts of financial toxicity on cancer care. What is financial toxicity? Financial toxicity can be defined as an economic burden which patients face as they result with their diagnosis, which could be a loss of job, medication, co-pays, chemo treatments, as well as radiation or surgery. These are economic burdens that they face, and then some of them are not able to handle it along with their diagnosis. So, how do we understand what financial toxicity is? In the United States, women who receive breast cancer treatment had a higher mortality rate risk when they experience financial distress, which financial toxicity can also be known as financial distress. Cancer care is one of the most expensive diseases, beginning from diagnosis, the consultation, all the way until hospice or until the end of life care. Financial toxicity, in some cases, may be just as important as the toxins that you get from the drugs. They're saying that they're equal because patients may experience this as they're going through their cancer treatment, which can have an effect on their survival. The impacts of cancer treatment costs on families as well as the patient. When you're going through a cancer diagnosis and they sit you down and they say, hey, or they call you over the phone and say, hey, you have cancer. One of the things that they never discuss is how much is this going to cost you? Mainly because they don't know. Because although they may tell you you have to do chemo and surgery, other things may come up while you're doing the chemo and the surgeries. People bodies may not take well to chemo. So you may have to be hospitalized while you're taking chemo because you may get sick from the chemo. I ended up getting sick. Hemoglobin was really low. I didn't know what was going on. Then I went to the emergency room and they said, "Oh, you need a blood transfusion." So ended up getting 2 pints of blood. So there could be things that take place during your treatment. So if the doctor sat there and gave you a number, then some people would try to make the doctor stick to the number that they gave them. And a lot of times the doctors don't know how much is going to cost you or even how much the treatment that you're getting, a particular treatment that you're getting is going to cost. All they know is this is the type of treatment that you need. And most patients, when you hear the words, you have cancer, you're not even thinking, um, how much is this going to cost me? You're thinking, am I going to live? Am I going to die? Like, what's going to happen with me? The last thing you're thinking about, probably at that moment when they tell you that, is how much is this going to cost me? How much is this going to cost my family? Am I going to be um, in a financial hardship because of cancer? Cancer patients they're 3 times more likely to declare bankruptcy than people with other chronic ailments. They did a study with individuals who have filed bankruptcy, and once they did it, they noticed that the majority of the people at the top of the list was those who had been diagnosed with cancer. And so if you're a stage 4 cancer, which we know is terminal, which we know there's no cure, and some of those individuals have to be on treatments for the rest of their life. So there's no end to the payments. And if you know that that's going to happen, some people may file bankruptcy every so often just so they can get some type of so-called financial freedom so that they'll be able to see a picture to say, okay, now those bills are gone. So let me try. And then you start over, you're back in the same cycle again. And you can only, if you have friends and you have family, there's so many times that you could go to those individuals and say, hey, can you loan me? Can you pay for treatment? You can only do it so many times before you max those people out. So what do you do? What do you do when this is something that you need, something that's life threatening, that has the possibility of taking your life, and you need this treatment? Your life is dependent on this treatment. What do you do? Cancer survivors may have financial problems for many years after their diagnosis. So it doesn't just happens when you get the cancer diagnosis, because things come up after your diagnosis. Some things don't show up till 10, 5 to 10 years later. Then you find out, oh, I have heart issues from the chemo. Because sometimes the chemo can cause heart issues. It could cause you to have issues with your heart. It could cause you to have issues with your kidneys because of the toxins that's being pushed in your body. And sometimes, although they'll give you this scan to see how strong your heart is, and then they'll say, okay, we could give this person chemo. Their body should be able to withstand this chemo. And they give you this chemo, not knowing that, yeah, at the time, because my heart was healthy at the time that you first gave me this medicine. But some people may get 16 rounds of chemo. And as you're doing the chemo, your heart is getting worse and worse. And if you're on that medicine for years and years, Just imagine how much damage you're doing to your heart, to your kidneys, and to other parts of your body that you really don't think about, but you're fighting to live. And the only thing you're thinking about is whatever it is that they're giving me is helping to prolong my life. So you're gonna find a way to pay for it, or you're gonna just keep taking it until you get tired of taking it, until your body just can't anymore. So patients who have financial toxicity may have a low quality of life. Why? Because all of your money is being used for this treatment. Every penny that you have is going towards treatment. People have sold their houses, their cars, moved back in with their parents, trying to pay for treatment. And so your quality of life that you once had is lower materially, but then it's also physically is lower because you have this treatment, you're not physically able to do the things that you normally once did. You're not able to run around and play with your grandkids because you don't have the energy. You're exhausted. You're fatigued from the poison. And so your quality of your life goes lower. You may be staying in the house versus every time somebody is inviting you somewhere, you don't go because you don't have the energy. Or you don't like the way you look. You're like, I don't want to go nowhere like I look horrible. I don't have any hair. I lost weight. And a lot of times with chemo, your skin turns so dark. We talk about you losing fingernails and toenails, and you get this. Sometimes you have a rash in your mouth to where it's like white. You know how a baby get what they call it thrash. It's like all in your mouth. You get I call them mouth ulcers until you're done with chemo. And so a lot of times you don't want to go anywhere. You don't feel like going anywhere. You're not able to go anywhere. So the quality of life goes down and you begin to retreat and stay in and be to yourself. And when you do that, then the less movement that you do. And we all know we talked about exercise last week, how exercise really improves your life and it improves whatever disease that you're dealing with. And it improves that. And if you're not even motivated to do any of those things. You're just dwindling, basically. The US healthcare system outperforms on costs. American pays more for medical bill care than citizens of any other developed nation. Any. But just about every other measure, like life expectancy. What is going on in the US that our life expectancy is lower and we have this healthcare system to where it does not benefit the humans. It doesn't benefit us. It puts you in financial toxicity. It puts you in debt. It puts you in a situation to where you're debating if you should get treatment or not. Why? Because you can't afford it. And a lot of people don't, when they get a cancer diagnosis, they don't go get a second opinion. Why? Because they can't afford it. Because maybe the insurance that they have does not allow them, does not approve for them to go and get a second opinion. So even if you don't agree and you don't feel comfortable with what has just been told to you, or even if you don't even like the way the doctor, the medical team, how they handle you, sometimes you just have to suffer through it because your insurance is not going to allow you to go anywhere else. And then once you have that cancer diagnosis on your insurance, sometimes it can be hard to insure you somewhere else. Sometimes they shouldn't say, "Oh no, you can't have insurance," but sometimes they may put stipulations on you getting insurance. And if you get insurance, it may be the lowest kind of insurance that's going to barely cover what you need to cover. Some cancer patients receive what they call nurse navigators, and they help you through the process to help minimize the stress. They set appointments, they obtain referrals, anything that has to do with whatever you need to be done throughout your cancer journey, they take care of it. I loved having a nurse navigator because I never made an appointment. And I have HMO, and you know, with HMO, you got to get the referral, you got to wait. I never had to do any of that. Whenever they said I had to schedule something, the nurse navigator took care of it. And all she did was call me and say, "Hey, your appointment is on this date at this place at this time." I never had to worry about it. And it was a relief because, and I'm going to tell you why, because some people may not make the appointment. We put things off. Why? We're busy with life. We're scared. We're fearful. We don't even want to go to that appointment. So guess what? I'm going to try to put it off for as long as I can, and that's only hurting you in the long run. But that's what we do. So the nurse navigator takes the guesswork out of everything, and she handles everything for you, and it really does relieve some of the stress that you have when it comes to being on the phone, being transferred all over the place, waiting for the doctor to get back to you. Like, they handle all of that. So if you don't have a nurse navigator, ask when you're there. If you are diagnosed with something, anything, ask, do you have a nurse navigator, someone that can help me navigate through this process to make it less stressful for me? Because it can be stressful and it could cause you not to want to participate in your own healthcare. All cancer patients should be assigned also a financial navigator or a financial counselor should be assigned to each patient. Does that happen? No, it doesn't. It should, but it doesn't. And if you don't have one, you should be asking your doctor, or call up your insurance and ask, do they have a financial counselor, someone that you can talk to that will be able to walk you through the financial portion of your diagnosis. You shouldn't have to do it alone. They help take the guesswork out of everything. They'll give you a realistic picture of what it is that you need to deal with so that you know what's coming. Okay, I have to have this treatment. Does my insurance cover this treatment? So that there are no surprises. You're not getting bills in the mail, letters telling you that you didn't qualify. You're not covered for that. A financial navigator should come right alongside of that nurse navigator so that you're not having to stress about money, about your insurance, because they can call over before. Once the doctor said, "Hey, this is the treatment that they need to do," that nurse navigator can call and verify that everything is covered. You shouldn't have to do that. Because the doctor just gonna prescribe it. They don't know. They're just gonna prescribe. And so maybe you could say, "Hey, well, maybe I can get a generic version of that, because then you won't have to come out of your pocket with anything." I mean, ask, advocate for yourself. This is your life. This is your money, and you have people depending on you. And we can't forget about family members who are also affected by financial toxicity, because the ones that are taking care of you, a lot of times they come out of their pocket with stuff. A lot of times they're having to take off work to take you to appointments. A lot of times they may need a mental health day, just dealing with everything with you. And they want to be supportive and they're going to try to do everything that they can. But a lot of times they're right along in that financial toxicity because you're their loved one and they want to make sure that you're taken care of. So if you have someone that's taking care of you, then appreciate them. Let them know often how you appreciate them taking care of you. Don't just take for granted that, oh, this is what they supposed to do. No, that's a choice. Because we know a lot of family members aren't built to do it. It takes a lot to be a caregiver to someone, especially someone with cancer, especially if they have stage 4 cancer. I watch my mom with my dad. I watched my mom with my sister who both passed away. And I don't know how she did it because I said to myself, I couldn't have done it. Like, it's a lot. But think about like even the hospice nurses that come in towards the end. Like, that's a lot. It's a lot to do. It's a lot of stress being put on that person. But because your family love you and they want to make sure you're comfortable and they want to make sure that you know that they've done everything that they could for you while you were here. And normally that's the person that's fighting for you, that's advocating for you. So you have to make sure that, you're treating your loved ones right who are voluntarily taking care of you and probably not even getting paid. The cost of cancer care is rarely discussed. I mentioned this between patient and the doctor, considering the financial impact. It should be discussed when they give you that diagnosis. Everything should be broken down with whatever the initial treatment is. Okay, you have this insurance, so this insurance covers this chemo. It covers this radiation. It covers this amount for surgery. This is how much you're gonna probably come out of your pocket with copays. The one thing that I can say, going to my chemos, I didn't have to come out of my pocket with copays every time I went. Like that, I didn't have to. The only time I had to come out of my pocket is when I had to take what they call the Red Devil, and you have to take this shot 2 days after you take it. So the shot was my copay for the shot was $100, and I mentioned before that once I didn't have this $100, I was just like, "What?" When they first told me, I was like, I don't have $100 for this shot." And then they had to tell my doctor, like, she just took this Red Devil. She said she don't have the money for the $100 shot, and 2 days later she gonna need it. It's supposed to stop you from having like bone pain from the shot, and among other things. Excuse me. So my doctor said, give it to her. Just give it to her. She needs it. And the pharmacy gave it to me. Now, has she said, well, I don't know what to tell her. Like, she gonna have to figure it out. And she said, give it to her. And she could have just sent me home and had to worry about the consequences or the repercussions of not having that $100. Or, excuse me, or I could have took it from a bill, my rent, my groceries, and paid it. And that's where that financial toxicity starts, because patients are doing that, just that. And you do it one time, then you do it again and again and again, and then you see yourself with this mountain of bills, this mountain of debt, all because you're trying to survive. You're just trying to survive. Kellogg says, I knew a person had problems like that. Her insurance wasn't good and she was getting worse. She worked until 2 weeks until she passed. She tried to switch doctors and hospitals, but her insurance wouldn't let her. And that is so sad. And that's the story of many people who have to work just so they can have insurance. And even though in their body is not even strong enough to work, because they're getting these toxins pumped in their body. So whatever strength that they have left, they're going to work. And she even tried to advocate for herself by trying to switch the doctors and the hospitals, but they wouldn't let her. Why? Because of the insurance, which is really, really sad. It is really sad. You should have a choice. You should have a choice to be able to, especially when you're going through something life threatening like that. You should be able to switch. You You should be able to advocate for yourself and say, no, this is not working for me. So I want to do something different. He said she was in extremely pain because she kept running out of medicine. Wow. She kept running out of medicine because the insurance did not cover it. And this is such a sad situation because some people they'll prolong the medicine. They'll not refill the prescription and not take or skip doses just so the medicine can last long. Or if they don't have the money, they'd be like, okay, I'm just gonna try to make it without it and see what happens. And it shouldn't be that way. And medicine should not be that high to where you can afford it when you, especially if you know that I need it. If you know that this person is fighting cancer and they don't have the copay when they go to the doctor, just either link them to a program that takes over, financial situations for individuals who are sick, you know, refer them to a program. They should have some type of system or programs, at these clinics, at these hospitals, to where if you have a patient that's not financially able to do that, they should be able to refer them to these different programs. And it's sad that they even have to worry about this while they're trying to heal. He says, yes, skip days taking medicine, just as you said. And I believe it. I believe it. And sometimes I think about the diabetes medicine and how these people who are diabetic, you need this because your pancreas is not functioning as it should. So your body is not making the insulin. And how a lot of times this medicine can be high for some people, depending on your insurance. And you need this for your body. So what do? Some people are skipping doses. Some people are just seeing how long their body can go without it, which can send your body into DKA, and you can go into a coma. You can have brain issues and everything. It could, but what do you do when you don't have the money and there's no resources around you to where you can make these things happen for you? A lot of times when you don't have that medicine, you start thinking kind of you're not in your right mind because you don't have the medicine that you need to function. It's sad. It really is sad. So, what are some strategies for coping with financial toxicity? There's got to be some type of something that the patients can do or their loved ones can do for them. Addressing financial toxicity in cancer involves implementing measures to reduce the financial burden. How do you reduce the financial burden for these individuals? And not even just cancer, just other diseases that people are being diagnosed with. And I mentioned the financial counseling, the financial navigator assistance program, being transparent with the pricing. Again, the doctors should be having conversations with their patients about how is this going to affect me financially? You are prescribing this type of treatment. What am I looking at? What are some of the past patients who have had this type of treatment? What did they come out of their pocket with? So that you can kind of brace yourself financially to know what you're dealing with. And I'm gonna tell you, if a lot of people knew upfront the amount of what they're going to be dealing with when it came to some of these diseases, they'll be like, I'm not going to treat it. It would be more stressful to treat it than not to treat it. A lot of them would just be like, I'm not going to do that because where am I going to get the money from? And you don't want to pass away and then you leave all this debt on your family. You don't want to do that. So there should be some type of policy changes that need to happen. And this is one of the reasons why I have volunteered with the National Breast Cancer Coalition, and we go to Washington and we talk to our congressmen and women about policies that need to be changed as it relates to individuals with breast cancer. And one of those issues is having them to waive that 24-month waiting period for people who are waiting for the Medicare. You have individuals who have been diagnosed with stage 4 cancer, and they are not able to work due to the side effects from treatment. So they have no income coming in and they have no insurance. And the law says they have to wait 24 months for them to qualify for this insurance, for the Medicaid. So a lot of them don't even have that. They give them 3 years for the Medicare. I'm sorry. A lot of them don't have a lot of them don't have the 24 months because according to statistics, you have 3 years. If you're diagnosed with stage 4 cancer, statistics say you only live 3 years. Now we know people are living way longer than 3 years, but according to statistics, it says you only should live 3 years. So if I'm waiting 24 months for this Medicare, a lot of them don't make it. They don't make it. And then we're fighting for the 5-month waiting period for Social Security. If they're not working and they don't have any income coming in, why are they waiting the 5 months for something that they already qualify for? They already qualify for it. So we're asking that they move these waiting periods, and so that these individuals who are diagnosed with stage 4 cancer can benefit from them and have some type of decent quality of life. Cancer care is already mentioned, it's expensive. It's one of the most expensive diseases that you can go through, but you don't get, with the high cost, you don't get a high quality of care. You would think that, oh, I'm paying all this money for this treatment. It should be a high quality of care because of the amount of dollar signs that are attached to it. But a lot of individuals are not receiving high quality care when it comes to cancer treatment. But they're expected to pay this high, these high bills along the way. It's stressful even talking about it. Number 5, when it comes to unveiling the impacts of financial toxicity on cancer care, signs of financial toxicity. This is how you know somebody is experiencing financial toxicity when they're going through cancer treatment. Is a lot of times their income is reduced, and the reason why the income is reduced is because, again, they're not able to work because of the side effects from the treatment. You're fatigued. You don't have the strength to do anything. You don't have it. So what do you do? Cadillac says some people don't understand the situation until it hits home. Over the years, I have learned about cancer, how many people hide it, wow, and why. But seriously, I really appreciate you for giving out so much knowledge on it. Thank you so much. Keep up the great work of spreading your knowledge. Thank you. I appreciate that. And you hit on a key point about people hiding it. A lot of people may have cancer and you may not know it. You may not know it. You may not. A lot of times they don't want people to know it because sometimes people will start treating you like you less than, like you fragile, like you about to die tomorrow. And, and then some people have this pride thing to where, you know, they they don't want people, to have pity on them. And some people are just private, period. And so but sometimes you have to let a selective few know what you're going through. Those people that are going to support you and rally around you. Um, don't be selfish. The people who are not supposed to be there will fall off. They will fall off. But you would be surprised at the individuals who are going to be there and love on you And because you shouldn't have to go through this burden all by yourself. You shouldn't. You shouldn't. But I understand being private. I understand keeping certain things to yourself just to keep your sanity. I totally get it. But you shouldn't have to go through a seriousness of a disease like this by yourself. You shouldn't. And the reason why I really talk about it is because I really don't want anybody else to go through what I've been through and what so many other people have been through with a cancer diagnosis. And so if I help just one person, then my advocacy is not in vain. And so I keep talking until whoever my message is supposed to reach, that it reaches. So yeah. So I appreciate you for listening, Kalak, and for your encouragement. I really appreciate it. So here's another sign that you are experiencing financial toxicity. I talked about this. Patients have a low quality of life. When you're going through a cancer journey and you're not able to make certain payments, or you're not able to um, pay your bills at home or live like you were living before the cancer diagnosis. And sometimes people don't have to say anything, but you yourself know it and you feel some type of way. And cancer can take a lot from you. Let me just say, it could take a lot from you. But you also, when you stop and think about it and you stop allowing it to take, you'll realize that you've gained a lot, And for me, I'm grateful. Just sometimes I complain. Sometimes I complain, and my mom has to remind me. She says, you know how many people who would love to be in your shoes who are not here, that, went through the same thing you went through and they're not here. So you should be glad that, and be thankful that God has allowed you to be here. And then I have to stop and I'd be like, oh, I am grateful because I've been able to witness weddings for my children, graduations, proms, get to see them, play sports and excel. And so my grandbabies. And so for that, I'm grateful. So I try to not complain as much. I have to check myself, bring myself back and be like, oh, you don't have nothing to complain about. You're still here. You're still here. And I'm able to do things for myself. I'm not, you know, um, I'm not disabled or in any type of way to where cancer has taken away my mobility or anything like that. Like, so for that, I'm grateful. Kellex said, your mom is right. I know. Sometimes I get in my little moods and I be like, just fussing and complaining. And she has to be like, you need to be glad that you're here. So I am. So being insured or underinsured or having insurance plans which have a really high deductible can be discouraging as well. You going through cancer treatment, they say, oh, your insurance doesn't cover this. This insurance plan does not cover this. It could be discouraging, right? It could disrupt your treatment, your healing, because if it doesn't cover it, and then now the doctor said, okay, it doesn't cover it, so now we got to come up with a different plan. We got to come up with something different for you to do. And then if you have a high deductible, they may say, well, we need this deductible. You have to meet this certain deductible before we will pay the rest. And you just like, where am I gonna get that from? I don't have that. I'm not even working. Like the treatments that you've already given me has caused me to not to be able to work. So some of them will miss doctor's appointments. Why? Because they don't have the money for the copay, or they may not even have transportation to get there. So they miss doctor's appointments, they miss treatments because financially they don't have it. and keep going to these appointments is only going to keep adding up. It's just going to keep adding up. So why am I going to keep doing this? And Cadillac hit on this about them not filling prescriptions or missing prescriptions because they can't afford it. So they skip doses, they prolong the time for refilling it, or just don't refill it. And then they end up in the emergency room because they haven't taken their medicine. And again, some of these people need this medicine to be able to live. If you're a diabetic, you need it. If you're going through stage 4 cancer treatment, you may need this medicine. So skipping is not an option. Some people may not be able to pay rent, again, buy groceries, even like a cell phone bill. Because I mean, you need a phone in the house in case an emergency happens. You need to have something. And so a lot of times people get embarrassed. They don't want to ask for help. A lot of times you have already exhausted the people around you. And so sometimes you just suffer through it until somebody say, girl, what's going on with you? I ain't heard from you in a couple of weeks. And oh, my phone's not on. Why you ain't get in touch with me? I could have paid your bill. And there are a lot of local cancer, non-for-profit cancer organizations out here that do help individuals with like just little minor things. They may seem minor to us, but it may be big to someone else. So on the Warriors Talk website, we do have a resource page to where you can go on there and for different things that you're looking for, different resources that would be able to help you. You could just go to warriorstalk.org and click the link for the resources and whatever it is that you feel like you're missing or you need in your cancer care. It's a lot of resources on there for you to click and check it out. Some people can't even afford you going through cancer treatment. You should be trying to eat healthy. And we know a lot of times healthy is more expensive than going to grab a burger from McDonald's. Well, McDonald's is expensive right now. But a lot of times the healthier food is more expensive or it's not even in our neighborhood. So a lot of times we have to drive out somewhere to go and get some fresh, healthy food just to, rebuild our immune system. So sometimes you can't even afford to get the groceries and the nourishment that you need for your body. So a lot of times you don't. You just eat what's convenient and what's there, which is not a good thing at all. I've mentioned this before. A lot of people end up filing bankruptcy every so many years that they can so that they can try to get rid of these medical bills. Hey, Angela, which is really sad. The last thing you should be thinking about is how I'm going to pay all these bills when you should be concentrating on your healing. So what do you do if you're having financial issues going through cancer treatment? You should be talking to your cancer care team before making any decisions that may impact you mentally and physically. You should be saying, hey, this is my situation. This is my insurance. How is all of this going to be covered? Talk to your doctor and your team about that financial counselor or navigator or social worker, someone that can deal with insurance issues. If you're having problems paying your bill or even eating, ask if the hospital have any resources. They may have some money set aside to where they can allocate to help people. Maybe, the doctor's office that you go to have a connection to where they can give you to where you can get help with, things like co-pays and housing and transportation. I know some cancer organizations, they pay for Ubers for you to get back and forth to your cancer treatment. So that's something that you don't have to worry about. See if your insurance plans has a case manager. And if they do, then you work with them to deal with your medical bills and whatever it is that you have to come out of pocket. See how they can assist you because you're paying. Well, you're paying for this service already. You're already paying for this service. A lot of times we don't use it because we don't know about it. And it's sad because financial toxicity is uniquely American. We know that in many countries that they don't experience this. Example, Germany, they limit their out-of-pocket costs for chronic illness. The patients paying 1% of their income, only 1%. In Norway, the patients are responsible for a maximum $281 out of pocket that they pay annually. And then they are exempt from other copays and costs. And here we are filing bankruptcy. I would say the one thing that the government did for us with medical payments is medical collections is that they don't really, I haven't seen them on the credit reports, and they don't really count against you anymore when it comes to credit, which is such a good thing. In Canada, patients can see any primary care physician and any referral specialist, no cost sharing, and no copay for hospitalizations. And it's only in America. In America, we are bogged down with these medical bills, scared to go to the doctor because you don't have enough money to pay for these different procedures that they want to refer you to go get. Angela said they're out there. You just have to open your mouth, put your pride aside or embarrassment aside, and seek help. Just ask for help. Ask how, I'm having issues, paying bills. I would start with my doctor's office first. I would get on the internet and I would type in cancer organizations that assist financially. And then I would go down the line calling them or filling out applications on how they can help me. And believe it or not, it's going to be somebody out there that's going to be able to assist you. Even if you have to get one of your friends to do a fundraiser, to where you do a fundraiser where people could come out and they buy tickets and everything, and they get to see you and see your story and fundraise for you. I mean, that may help for a while, but it may knock off some of the bills for a little bit, but you could do that. That's one option. All right, that concludes unveiling the impacts of financial toxicity on cancer care. So I hope that you guys were able to learn some information that you can share with other individuals when it comes to financial toxicity. You never know who may be dealing with it. Again, you can go to warriorstalk.org. I have a resource page to where you can find some resources if you are dealing with that or you know someone who is, and share that resource page with them. Warriors Talk is grateful for our sponsor, Gloria Dotson with Mary Kay. She's catering to all of your beauty needs from head to toe. You can go to marykay.com/GDOTSON for any of the Mary Kay products. And Warriors Talk is always looking for individuals who would like to share their story on Warriors Talk. We have testimony on Monday. So I'm looking for individuals who would like to empower and educate other individuals with your journey. Just inbox me the word ready, or you can email me at warriorstalk1@gmail.com. Warriors Talk will also be having our 8th annual Survivors Night of Reflection Gala. This is taking place on Saturday, October the 19th from 11 a.m. to 3 p.m. at the Crystal Sky Banquet Hall in McCook, Illinois. We're celebrating all cancer survivors. We're going to award a Survivor of the Year, a Warrior in Battle financially. Sponsorship and vendor opportunities are available. You can email me at warriorstalk1@gmail.com. Don't go anywhere. Coming up next on Intellectual Radio is Pillow Talk with God. As always, Warriors Talk is grateful that you have tuned in. You can join me next Monday right here on Intellectual Radio at 6 p.m. As always, Warriors Talk is grateful for you tuning in. This is author and founder Lady ReShell. Warriors Talk is changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on IntellectualRadio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.